First Light, WEX, and Harvard Pilgrim Healthcare. Community Corner sponsor, Goral Palmer. Parking sponsor, CV and Mahar Engineers. Reception sponsors, Clark Insurance, KeyBank, and Veril. Tomorrow's Leaders and Entrepreneurs sponsors, Springborn Staffing Center and AAA Northern New England. Media partners, News Radio WGAN, The Forecaster, WMTW News 8, Maine Biz, with production support provided by Headlight. And thank you to our 2019-20 special community partners. Anthem Blue Cross Blue Shield, Spectrum Healthcare Partners, the University of Southern Maine, and Southern Maine Community College. And now, please welcome Portland Community Chamber President, Jim Cohen.
Good morning and welcome to our second virtual Eggs and Issues. My name is Jim Cohen. I'm a partner with the law firm Veril, and I'm honored to serve as the volunteer president of the Portland Community Chamber Board of Directors. I want to thank all of you once again for safely joining us this month for Eggs and Issues. For years, we have been able to enjoy each other's company and creative breakfast cuisine at the Holiday Inn by the Bay in downtown Portland. But now that gatherings of this size must be virtual in order to keep us safe, Eggs and Issues has also gone virtual. That means you bring the eggs and we bring the issues. We also get to invite you into our homes and offices around the state, including mine in the North Deering neighborhood of Portland, as we learn about key issues facing our region and state as a whole. Due to the COVID-19 pandemic, the Chamber continues to offer virtual events with the goal of safely keeping us all connected and informed on the important issues of the day. In this regard, today's program is actually a continuation of last month's Eggs and Issues, and will focus on the current impact of COVID-19 and the governor's plan for restarting Maine's economy. Leading us through this timely topic are three amazing guests who have become key figures in the state as we navigate the COVID-19 crisis. Our first guest, who also joined Eggs and Issues last month, now boasts a vigorous fan club on Facebook, Dr. Nirav Shah, director of the Maine Center for Disease Control and Prevention, who has done an incredible job of keeping us all informed about the spread and management of the COVID-19 pandemic. Also with us today is another panelist from Eggs and Issues last month, Heather Johnson, Commissioner of the Maine Department of Economic and Community Development, who has been leading the state's effort to reopen our economy based on guidance from the CDC and to provide advice to local businesses as they work to keep going and continue employing Mainers. Our third panelist is new to Eggs and Issues, but not new to Maine or the state's effort to address the COVID-19 pandemic. Jean Lambrou, Commissioner of the Maine Department of Health and Human Services, who has been at the forefront of the state's response to COVID-19, including her role in managing Maine's CDC. We're very fortunate that these three key leaders are with us today, not only because of the important role they have each played in our lives over the past number of months, but also because under their able leadership and tutelage, we have now become small e experts in virology, public health, social and physical distancing, quarantines, and essential businesses. As a testament to the importance of the topic and the quality of our guests, we had record attendees tune in last month for our first ever virtual Eggs and Issues. We expect similarly large subscription numbers today from around the region and state. Before we start today's presentation, I do want to take a moment to thank all of our sponsors who have helped to support the important work of the Portland Chamber as we work to educate and advocate for our member businesses. I also want to thank our CEO, Quincy Hensel, and all of the amazing staff of the Chamber who have been working harder than ever to support our members as we navigate this public health crisis. Thank you, and let's give them all a virtual round of applause. Now, turning to today's program, we will begin with Dr. Shah, who will say a few words about the important work of the Maine CDC. Dr. Shah has to leave us by 8:30 to continue the work for the state. So we'll start with a brief set of questions and answers with Dr. Shah right after he speaks. He will then be followed by Commissioner Johnson, who will talk about the state's effort to open up the economy And then Commissioner Lambrou will discuss overarching public health implications of the pandemic. Then we will move to a broader Q&A. As with prior Eggs and Issues, we encourage questions from the audience. If you want to ask a question, you can submit it at any time during the presentation through the chat function on your YouTube screen. But to do so, you will need to log into your Google or YouTube account first. With that, we would like to start the program with our first presenter of the morning, Maine CDC Director, Dr. Shah. Welcome, Dr. Shah.
Good morning, everyone. Thank you so much to Jim and Quincy and everyone who's joined this morning for the invitation to be with you again. I enjoyed meeting, as it were, everyone last month, and I'm delighted to be here again as well. I really do value this opportunity. I'm very thankful for the invitation. As Jim mentioned, I do apologize up front that I may have to depart a bit early, but I welcome the opportunity to provide everyone with an update on where things stand and certainly take any questions that folks have. So I'd like to first, what I'd like to do is just provide a quick snapshot as to where things are, talk about some of the positive signs on the horizon, also talk about some of the concerning signs on the horizon, and then provide everyone a glimpse of where Maine CDC is going with our own internal operations and our planning going forward. I was, in preparation for this morning, I took a look back on my calendar to try to get a sense of when we at Maine CDC first started organizing our efforts around coronavirus. And it turns out that it was over 4 months ago, right after the new year, is when my team and I started sitting down to take a look at what we, at the time, was just an emerging virus in central China and has now, of course, become a global pandemic. Since that time, since the first cases emerged in China in late December or early January of the past several months, there have now, of course, been hundreds of thousands of cases in the United States. Sadly, well over 70,000 individuals have passed away just in the United States. And here in Maine, of course, we haven't been spared, unfortunately. As of last night, there were about 1,477 cases of coronavirus across the state, and over 200 individuals just in Maine have been hospitalized at some point. And sadly, we've lost 65 Maine people to coronavirus since we first started tracking all of the numbers several months ago now. There are, thankfully, some good signs on the horizon, however. For example, the number of individuals who have recovered from coronavirus has now risen to over 900. Being recovered is a designation that Maine CDC makes when our epidemiologists touch base with confirmed cases, and we follow the guidelines from the US CDC. Just yesterday alone, we added 41 new individuals to the rolls of those who have been classified as recovered. In addition to that, we yesterday received our first shipment of a drug called remdesivir that many of you have doubtless heard about. This is a drug that the US FDA recently issued a quick approval for to allow physicians to use it. The data are still being generated about what the ultimate use of remdesivir might be and the ultimate value it might add to physicians' toolboxes, but the US government provided us with the shipment yesterday. We immediately pushed it out to healthcare systems so that doctors in those systems could start treating critically ill patients. In addition to that, there are some other positive signs. For example, an outbreak that we had been working on for well over a month at a nursing facility in Waldo County went a full 18 days without logging a single new case. This is a facility in Waldo County called Tall Pines. That too was a positive sign. It suggests that with quick action and solid scientifically based public health responses, outbreaks at nursing homes, even if they are severe, can be brought under control, even though we know it takes a couple of days, if not a couple of weeks to do so. So there are some positive signs on the horizon. Unfortunately, there remain several concerning signs on the horizon as well. For example, the number of individuals who are in intensive care unit beds right now in Maine still hovers at around 20. Yesterday it was 17, a couple of days ago it was 25. That's still a significant number of individuals and family members who have loved ones who are in critical care units right now. That's a concerning sign. We've also seen a significant and rather steady increase in the number of cases of anywhere from 15 to 30 cases per day over the past several weeks. The other concerning sign on the horizon is that many of the cases, that we have continued to see small, in some cases, medium-sized outbreaks in what we call congregate care settings. These are settings that range from nursing homes to group homes to any type of situation where a large number of individuals may be in close proximity to one another for a prolonged period of time. And we've continued to see new outbreaks in facilities of that nature just over the past several days. All of these signs, though concerning, do mirror the national trends, which is to say Maine is not unique in continuing to see new cases on a daily basis. Maine is not unique in continuing to see a lot of those cases associated with congregate care settings. But what it does tell us is that there's more to be done. And so what I'd like to wrap up my remarks with is providing a snapshot of where Maine CDC is currently focusing some of our efforts and what we're going to be focused on for the next several weeks to months. And it really boils down to what I think of as what I call the 3 I's, which is to say case identification, isolation, and investigation. So I want to break those 3 down. On the identification piece, this really comes down to testing. And there, I've got some good news to report as well. Last week, Governor Mills announced a deal and a partnership with our colleagues at IDEXX. IDEXX is, of course, as everyone knows, is a world-renowned diagnostics company based right here in Maine. IDEXX recently received FDA approval for their human-based coronavirus test. Maine CDC, the Maine Department of Health and Human Services, and the entire Mills administration had been in close contact with IDEXX as they were going through that process. As they were in the process of receiving their FDA authorization on an emergency basis, we were in the process of discussing with them first on the scientific piece, how we could be helpful, and then from a diagnostics perspective, how we could increase our own capacity at our state laboratory up here in Augusta. We've successfully struck a deal with IDEXX that over the next week or so will allow Maine CDC's laboratory to more than triple our testing capacity. As everyone has no doubt heard, testing is really one of the keystones of any strategy moving forward. And we're happy that we will be able to more than triple the amount of tests on a daily basis that Maine CDC's laboratory is able to run. This is a core component of that first I, identification. I want to underscore something that's really, I think, important. The Maine CDC laboratory is not the only laboratory where testing is and can be done. We are one of several players out there, including hospital-based laboratories, as well as large multi-state laboratories like Quest and LabCorp. We welcome each and every one of those facilities to the table so that there can be as much testing as possible done in Maine. And we're proud to be able to do our part by working with IDEXX, again, to more than triple the amount of testing capacity at the state. So that's the first I, identification. The second I involves quick investigation. As soon as a case becomes or is known to be positive, we are building out our force of contact tracers. You've undoubtedly, again, heard about contact tracers in the media. Contact tracing is something that has always been done in public health for any type of infectious disease. COVID-19 is no different. But because we will be testing more, because we've ramped up that capacity with partnership with IDEXX, as a result of doing more testing, we anticipate and are planning for the fact that we will discover more cases. That's by design. But we also need to make sure that as we discover those more cases, we can have people out there who are touching base with those individuals, checking on them, providing them with public health guidance, making sure that they're taking steps to stay isolated inside to limit the spread in the community. So we're building out our contact tracing force as the number of cases goes up. As we do more testing, as we know we'll find more cases, we're hiring more and more epidemiologists to make sure that contact tracing piece keeps pace with the increased testing. The third part of the stool after identification and investigation is providing individuals with a safe place for isolation. After someone is diagnosed as having COVID-19, the most tried and true public health step that they can take is to isolate themselves so they don't spread the disease to others. But that's a challenge for just about anybody out there. But if you're somebody who has pre-existing health conditions, if you're someone who's struggling with homelessness, if you're someone who's struggling with substance use disorder, the ask to stay isolated for a particular period of time, especially if, for example, you're struggling with having a home yourself, is an added challenge. So we need to make sure that as we are asking people to stay isolated, we provide them a safe place to do so, as well as provide the wraparound services to make sure they've got food, to make sure they've got their other healthcare needs taken care of, and to make sure that, for example, any behavioral health concerns they've got don't get exacerbated during that period of isolation. Isolation is tough. It's tough for anybody, but that difficulty is magnified several fold if you're already grappling with other issues in your life. So those three I's are really forming the basis of the public health response to coronavirus going forward. Of course, to say nothing of the other healthcare system responses that Commissioner Lambrou can discuss, as well as the economic health issues that Commissioner Johnson can discuss. So I'm going to pause there, and Jim, as I understand it, you'll be moderating the questions.
Yes, thank you so much, Dr. Shah. And again, we really appreciate the hard work of you and your team as we navigate what seems to be an ever-changing and challenging landscape. So thank you. Several questions. You talked about what was a very exciting development with IDEX and the opportunity to greatly increase our testing, and you noted that we, as a virtual result of more testing, we will have more cases. How does the state plan to factor in those additional inevitable increases in terms of measuring, are we hitting our targets for reopening the economy? How do we measure that?
It's a great question, Jim. I mean, as far as how it intersects with the economic development or reopening piece, I'll let Commissioner Johnson address that. What I will say, though, is that one of the things that we know in public health is that when you go searching for things, you will find them. And that's the situation we are in right now. Our view is that we should be aggressively looking under every rock for cases of coronavirus in any type of setting, whether that's in an office with a physician or at a congregate care setting. So we anticipate finding more cases. So then the question is, well, if we anticipate seeing more and more cases, how can we talk about some of these other efforts? And so I want to make two observations there. The first is that it's not simply a matter of looking at one singular factor as we talk about the future. So it's not simply a function of the number of new cases per day. We're also looking at, for example, the intensity, the magnitude of impact that has, for example, the number of folks who are in the hospital or in intensive care units. The other factor that we always take a look at is not so much the number of new cases, but the number of new cases as a function of the total number of tests. The fancy term for that is the positivity rate. What percentage of all the tests that we're doing are actually positive? And if we're doing a lot more tests, but the percentage that are positive actually ends up falling, that's a good sign. It tells us that the net that we're casting is getting broader and broader and broader, which means we're testing more and more people. Even though we might be finding more cases, it gives us security that we're seeing as much of the iceberg as possible.
That's appreciated. Thank you. Along those lines, I've had a number of people say, how do we really know the extent of the spread of the virus in Maine, since all we're seeing is the snapshot of people who happen to be tested, and people have read about samples that have been done in other places. Has any thought been given to doing random sampling to get a sense as to what the real spread of the virus is in Maine?
Yes. So, Jim, the phenomenon that you describe about the fact that we're only ever seeing a certain part of the iceberg holds true not just for coronavirus, but for any type of infectious disease outbreak that we might have. And that's something that we build into our modeling. And we project different scenarios where perhaps we're only seeing 10% of the true number of cases, all the way to perhaps we're seeing 80 to 90% of the true number of cases. But the other idea that you noted is one that we also think about in infectious disease outbreaks, It's what's referred to as sentinel testing, which is to say going out in the community and asking folks to be tested for a coronavirus, even if they might have gone to their doctor because they sprained their ankle. And that helps us get a better sense of what's going on out there in the community. And as a result of being able to have more expanded testing capacity, this type of public health activity, the sentinel testing, is really truly what a public health lab is about. Those big lab companies like Quest and LabCorp, big commercial labs, they're great for getting your cholesterol checked, and they can churn out a ton of those. But when it comes to doing tests on people like from the doctor's office, who we're just asking to sample for public health reasons, that really speaks to the value of what a public health lab can do and why this partnership with IDEXX is so critical to expanding our capacity.
That's great, thank you. Now, in your eyes, your three eyes before, one related to contact tracing. And Maine is a state that very much values its privacy. How does the state manage, on the one hand, wanting to know who an individual has come in contact with the important public health need to make sure we know who's been infected?
So, Jim, that's a great question. Privacy concerns always loom large when we're talking about any outbreak, especially outbreaks that are affecting people's health. There's no question about that. So we put certain safeguards into place as we go through the contact tracing process to try to provide people a sense that their privacy will be respected in every single way. So for example, Jim, if we were to call you, and if one of our epidemiologists were to call you and say, Mr. Cohen, you have been identified as a close contact of someone who's tested positive for coronavirus, we won't indicate to you who that close contact was. You might ask us, you might say, well, who was I in contact with? I want to know. Our epidemiologist won't reveal that. So there's a lot of compartmentalization in the contact tracing process that preserves privacy. We do that deliberately because we know that if names will be shared widely, the person who you might have been in contact with won't divulge names because they may not want to be socially shamed, for example. So privacy really is a core piece of the contact tracing work, but it also has to be balanced with the fact that there's a global pandemic going on. So we don't reveal names. We don't reveal where you might have been in contact with the person. We don't reveal when you might have been in contact with the person. So we always try to maximize privacy, but recognizing that there is a balance to making sure that we don't have the uncontrolled spread of a global pandemic here in the state.
Thanks. And a related question for the individual who has tested positive, to what degree is that individual obligated to provide information? Does their cell phone data become used as part of that? How does that work?
So a good question, Jim. So for the individual, the case who is tested positive, the patient, we ask them to provide their contacts to us. And what I will tell you is that almost without fail, in fact, I'm not aware of a single instance thus far in Maine, not just with coronavirus, but in general with infectious disease outbreaks, where someone has declined to share the number of contacts or the names of their contacts with us. In general, overall, at the national level, the US CDC director, Dr. Redfield, has indicated that compliance with those requests from public health officials is well into the high 90% range. And so what we see, I think personally in outbreak situations, is that rather than folks separating themselves, they actually usually come together for the sake of community. And that type of cooperation we see with public health officials is just one example of that. I want to answer the other question you noted. I want to answer it really head on. We do not have access to, and nor do we access anyone's cell phone data, license plate. We do not have access to that.
Great. Well, given the hour, and I know that you need to move on to your next important engagement, I want to thank you for joining us again this morning, and thank you for all of your good work, and understand that you'll need to drop off in a moment. So thank you. Now I'd like to turn to
Thank you so much, everyone.
Take care. I'd now like to turn to Commissioner Heather Johnson, who's going to talk about the process and steps and what we might expect going forward with regard to Maine's economy. Commissioner Johnson.
Great. Thank you, Jim and Quincy in the Portland Chamber. We really appreciate kind of having this opportunity to get feedback and to talk through some of these processes. We know this is an incredibly difficult time and there's lots of information for everyone to try to work through. And so appreciate the opportunity this morning. I think Dr. Shah indicated this as well, but I would like to start just with some thoughts around this collaborative work. We've received over 4,000 inputs to our portal from businesses and citizens and employees, really looking at practices, ideas, suggestions, ways to do things. That's been incredibly helpful. And that partnership has continued into this kind of collaboration between economic health and public health. Sometimes we're hearing very publicly that it's either or. And I think the reality is, and Commissioner Lambrou might speak to this as well, public health and economic health are so intertwined. There's almost no way to separate them out, right? It's really difficult to have a strong economy if you don't have good public health. And it's really difficult to have good public health if you don't have an economy where people can meet their basic needs and be able to thrive. So we are trying to kind of walk through this together in a very integrated way to make sure that we continue to find that balance between protecting public health to its utmost and bringing economic health with that. So kind of having said that, about a week and a half ago now, the governor launched the Restart the Economy plan. We've indicated that that is a framework that is flexible and open to kind of lots of thoughts and inputs and adjustments. At that point, we did talk a little bit about a regional lens. That regional lens depended on additional testing capacity. And as Dr. Shah indicated, the IDEX relationship last week helped us hit that standard. Therefore, we opened up a section of the state. So 12 counties have additional things pulled forward, business sectors pulled forward, like retail, and restaurants will open on Monday in our 12 rural counties. So we've worked kind of with all of you and with some of them, lots of folks in the 12 counties to figure out what are the guidelines, how do we do this work and try to keep people safe, how do we make sure businesses can operate in a safe manner, and what tools might they need to do that. And so that work continues. We update checklists weekly as they get implemented. We learn more, businesses learn more, provide additional feedback, and we can make adjustments to those as we go. So the first round of checklists has a lot of input from diverse businesses across the state and diverse in size as well. So we use that in partnership with a healthcare team that Commissioner Lambrou has put together to really put together these guidelines that can work for businesses and work from a healthcare perspective. I would say both sides in most of these cases have had to compromise a little bit to make sure that we can get to a working model. And then those guidelines get posted and executed. And once they are in place, we've seen some small tweaks and adjustments that we've needed to make. So we will make those on a weekly basis so people know what those are. They go back up on our website with a date and a highlight on what's changed. And if you've logged in to download the checklist, the new checklist is pushed out to you electronically as well. So that's that piece. You heard Dr. Shah talk a little bit about the investigation components. In a couple of the checklists, it does include being able to know who was in certain establishments at certain times, so that if there is a case where we need to reach out to people who are in a building at a particular period of time, we have that opportunity to do that and do that quickly. And so really the bar there is pretty low. For restaurants, it's the first name and some contact information from one person of each party to make sure that we know how to get to people quickly. Time is an enemy in the case of a positive case where we need to try to isolate the impact as quickly as possible. And so being able to have that access to that information quickly is really important. So for most of the people on this call, right, in Cumberland and York counties, the first stage of kind of a broader opening will happen on June 1st. We've gotten some interesting feedback even in the last couple of days about ideas and suggestions for the how. And so we'll continue to work through those and make adjustments as they are appropriate and needed by businesses. That feedback is incredibly helpful. What I will say too is if you've sent information in, what we're doing is aggregating it by industry sector so that when we review industries, we use that. So if you've sent a plan in or suggestions in and not heard direct feedback on your specific plan, we're trying to look at those as broad sectors so that we don't have a lot of one-off individual actions happening. For the most part, we're trying to keep groups together. Certainly there are some instances where there were very individual circumstances that we need to look at that way, and we will do that as well. So with that, Jim, I think maybe if we can introduce Commissioner Lambert so we leave plenty of time for questions.
That sounds great. Thank you so much. Commissioner Lambert, please welcome again and look forward to your remarks this morning.
Well, thank you so much. And it's great to be here, especially since I got to meet many of you at the State Chamber of Commerce meeting back in February, which seems like 10 years ago for me, at least. I'm not sure about you. So I won't be long. I'll just point out 3 different components. Number 1 is that we're here today partly due to the public health work that Dr. Shah mentioned, but also partly due to the work of Maine's healthcare providers, the hospitals, the health systems, the physicians, because part of the key to beginning to tackle COVID-19 is ensuring we have surge capacity. That means if we have a big outbreak and people need to get to hospital care, ventilators, intensive care, I'm proud of the work that we've done in partnership with Maine Health, the Northern Light, the independent hospitals, Central Maine Medical Center, Central Maine Healthcare System, Maine General. We've had a great partnership that has enabled us to be to a point where we have sufficient capacity, not just for a surge today, but we're crossing our fingers for a surge with tourism. So we have been eyes on both where we are today and where we need to be this summer. Second, going back to the checklist, I think Heather Johnson is, humble in a way about what she's taken on as an approach. We're not doing this as some other states have done. There's not an executive order that writes in every little thing that the businesses in Maine should abide by. We're not doing this through regulations. We're doing this in a collaborative way with our business community to, again, find that balance of public health and practical business functions or processes so we can make this work for the state of Maine and not be a hardwired set of rules for businesses. And as Commissioner Johnson said, we will update them as needed. It's been a good partnership and we appreciate all the input that we've gotten. And third, I will go to the broader public health and healthcare implications. So we clearly have Maine Public's health at the center of a lot of our activity that relates to COVID-19, but there are other health issues as well that we're tracking. We've been worried that many people have delayed healthcare, including needed healthcare, in this period of time out of fear and concern, out of an overly rigid interpretation of the stay-at-home order. So we have been very concerned at the drop-off in people getting care for diabetes, care for chronic health conditions. We know many people in Maine have chronic illness. So as we begin to move through stage 1, which is saying, if you need healthcare, go get it. We have our hospitals, our health systems, our clinics are beginning to reopen. We really want to make sure that we have not harmed people or that people's health is not harmed due to this period of time where people were staying away from healthcare. So that is what's happening now in stage 1 as one part. The second is mental health. We know from past recessions, certainly going back to the Great Depression, that economic downturns have real world health consequences. So we are quite focused on what do we need to be doing now to protect people's healthcare due to that may be harmed due to losing jobs, losing their self-respect, losing their health insurance. We talked yesterday about the importance of people getting health insurance and the options that they have. So when we are considering all of this work in our different stages of restarting Maine's economy, we are obviously focused on COVID-19, but we're secondarily focused on how do we make sure Maine people get healthcare that they need, as well as how do we prevent the problems that we've seen in past economic circumstances that are correlated with recession. So we are focused on all three of those different health impacts. So with that, I'll turn it back to you, Jim, for questions.
Great. Thank you so much, Commissioner. Both Commissioner Lambrou and Commissioner Johnson, you have been doing yeoman's work and know that these types of crises and challenges take us all by surprise and require a tremendous amount of effort and thought. And on behalf of all of us, thank you and the entire administration for the hard work and the good work that you're doing, trying to balance the public health and safety needs, as well as the need to keep our economy going in these unprecedented times. So we have had a number of questions come in, fairly wide ranging from particular industries, as well as some process type questions. But let me first ask a question. Obviously, Maine's hospitality industry is very important. We've heard from a number of our members within that industry, whether it's restaurants, hotels, and even outside of the hospitality industry. There was an article in the paper today about cosmetology or barber tourism of people coming to Maine to get a haircut. So there was a 14-day quarantine requirement, and there's a lot of questions, confusion about how does one really quarantine? Can one come to a hotel and stay inside a hotel for 14 days and eat junk food in the hotel to quarantine? Can they come to a hotel and go hiking? Where are the limits? What's allowed? What's not allowed?
So Jim, maybe I'll start with that, and then Commissioner Lambrou, if you want to jump in on the quarantine specifics. Certainly tourism is an incredibly important sector for the Maine economy, not just for what tourism generates on its own in the businesses in that sector, but certainly the supply chain to the tourism sector, right, is a really large piece. It's also kind of at that intersection of all of the high risk points for COVID-19, right? It's about travel, it's about congregation, it's about attracting people from other places, not people staying kind of in their own areas. So there's a lot there to work through. I think we are working kind of very closely. Commissioner Lambrou and I actually went on a lodging tour last week and looked at a couple of different solutions in play. So that, right, when you talk about some of these solutions, it's a little bit easier when you can see them in practice and see how they would be implemented. So I think we are actively looking at mitigation options for tourism around how could we have a broader tourism season and still keep people safe, right? We have this is again where we get into this balance of we need to keep Maine residents safe. We need to keep tourists safe, frankly, as well. And we need these tourism businesses to be able to execute and thrive. So as we put all of those together, there were a number of ways to do that. Quarantine is currently part of the solution. We are looking at lots of other options as well, but quarantine right now is the tool, as the final backstop. And I think as you look at other states like ours, everybody is working through a very similar process to what we are doing as well, trying to get to an effective answer that allows these businesses to thrive, allows people, frankly, to come and enjoy Maine's assets, right? If you look at the surveys, people now want drive travel and they want outdoor assets, and certainly that's our sweet spot. So that's the good news. Now we've got to figure out how to do it in a safe way. Commissioner Lambrou, I'm going to pass the quarantine detail questions to you, if that's okay.
Sure. And I think I won't add too much because I think it's spelled out. Quarantine is one of the areas that is written in an executive order 34, that was published on April 3rd. It does, say that if you come to Maine, you should stay at home for 14 days, with the exception of leaving for essential activities. We recognize that is a pretty strict standard, but that is in the absence of a vaccine and in the absence of widespread treatment for COVID-19, one of the few public health tools that we have. This executive order was extended through the month of May. As Commissioner Johnson said, we are looking at options and alternatives. We appreciate the challenges that 14-day quarantine policy holds for tourism. At the same time, again, in the absence of clear alternatives, that's what we have today. But we are looking at alternatives for the future, recognizing the limitations that places upon.
Thank you. A related question, I heard a creative suggestion last week that might go into the bucket of an alternative to a quarantine, but is there any consideration to creating something like for businesses, there's a badge if you follow certain requirements as a business? Is there any possibility of having a clean bill of health for an individual based upon testing? That they've had a test, that they've been found not to be carrying the disease, and that might be a waiver to a quarantine.
We are looking at all options. That is one option we're looking at as well. Just note that, the science is evolving very rapidly. We do have more testing capacity, but as Dr. Shah mentioned, the first priority probably is sentinel testing to make sure that we don't have endemic COVID-19 throughout the Maine population. But we are certainly looking at that and other options that states are considering as either a substitute for or a complement to quarantine.
Great, thank you. And I guess a further related question to testing, a lot of conversation has been occurring on the chat this morning about, hey, what if I want to be tested? Can I get tested? How do I get tested? Where would I get tested?
So we still, as of today, are prioritizing our testing at our public health lab to healthcare workers, frontline workers, older Mainers, and a few other categories. But as Dr. Shah said, we expect in the coming days to have the broader capacity, which would mean that we could test people who are suspected of having COVID-19. What that means is either you have the symptoms or your physician or primary care provider recommends that because of some contact with somebody who had COVID-19, you should be tested. That's what you call individual level testing. And being able to have our public health lab do it for anybody who is suspected of COVID-19 puts Maine at near the top in terms of our public health lab capacity, which is great. We also have done sporadic, what are called universal testing. So when there's an outbreak at a nursing facility or a group home, we are testing everybody. That's called universal testing. And then the third round is sentinel testing, randomly testing the population to see what's going on out there. We are not to the point where if I just say I want to be tested, I can get tested. It's not a good use of a test, but it's also not good for you because you may get tested today and have a negative test, but you go somewhere, you run into somebody with COVID-19, you don't wash your hands, you could have COVID-19 tomorrow. So we want to be careful about our testing strategy here because it is still a scarce commodity as of today. And we want to make sure that we're using our testing capacity wisely.
Great, thank you. So this question may be a combination of both public health as well as reopening the economy. As you can imagine, as a lawyer in my office, we get lots of questions from businesses. What do I do? How do I open up? Do I have to open up? What if I open up and do the wrong thing? Am I going to get sued? Now, there was an op-ed in the paper yesterday from an attorney saying that the possibility of lawsuits coming from COVID-19 was a hoax, and businesses shouldn't worry about lawsuits. Nonetheless, businesses do worry about lawsuits. And so they want to know, tell me exactly what I should do, because ultimately, whatever standard is out there becomes the standard of care. And if that standard is vague or ambiguous, and a business is left to interpret that, that is risky. Any words of advice in terms of how does a business navigate standards that leave it up to the business itself to determine what's applicable?
So I guess maybe I'll start with this one and then Commissioner jump in. So we have tried to create really clear guidance, and then in some places say, consider this, consider that as potential upgrades if businesses want to kind of upgrade their standards. Again, I think you make these for the broad majority of the population, and then individual businesses right, have certain circumstances that would give them either opportunity to upgrade the impact or the kind of protective options or not. So, our goal is to create clarity and a safe standard for businesses to operate on. Certainly businesses can operate on top of that and add additional layers of protection, and we encourage people to do that as that fits. Under no circumstances are we saying you have to reopen. Lots of businesses are saying, look, we aren't ready to reopen yet. We aren't there yet. Either our employees don't feel comfortable, or we want more time to prepare or whatever. And that is absolutely in that businesses to do that. We encourage people to kind of take those decisions that work best for their business. Our goal, right, is to try to find that line to create as much flexibility as we can and still keep people safe. So certainly as businesses want to overlay, I think that's great. Jim, I will defer the legal guidance though to you. Okay.
Me too.
Fair enough. I guess maybe even a follow-up to that. Obviously, CDC guidance. There's national CDC guidance. It's probably most applicable to businesses in the healthcare industry. I've had only limited opportunity to review it, but even though I'm a lawyer, to some degree, it makes my head spin a little bit, and it requires healthcare businesses to figure out, are they in a high risk, medium risk, or low risk category, and whether or not to apply certain personal protective equipment. Again, any direction or advice as to how businesses should figure out how they fit in, where in the risk category, what equipment, what other activities that they should be taking.
Sure. And healthcare is different than other businesses, and we've taken a different approach to healthcare in Maine than we have to non-healthcare businesses, because there is US CDC guidance for healthcare. There's also US Centers for Medicare and Medicaid Services guidance that has been issued about reopening and about procedures. So we feel as though there's federal guardrails and guidance that have been issued, and we are relying on them rather than creating something specific to Maine. We don't think that's needed per se. There's rare cases like dental where US CDC has been behind in its recommendations. They admitted yesterday that they're updating them, so we're hopeful that that will come along. But I think when it comes to healthcare, their mission and their practice, even before COVID-19, included infection prevention and control. So they had personal protective equipment at most healthcare facilities before COVID-19. They know what to do when a person has COVID-19 or tuberculosis or SARS or some other infectious disease. So we have a different capacity, a different readiness in the healthcare sector that your average business in Maine doesn't have. I mean, PPE was probably a new acronym to most businesses in Maine before COVID-19, whereas it's definitely something that people in the healthcare industry know. So there is a different standard that we're using for healthcare for the reason that they are, again, healthcare providers with the same mission that we have at heart, which is the public's health. And we are confident that they are complying. I mean, this is going back to Dr. Shah's statement about people reporting their contacts. We have had great response and responsibility of our businesses, healthcare and non-healthcare in Maine, adhering to these recommendations, because business leaders, customers, patients, we all share the same goal. And so we are confident and hopeful that in this world, we don't have to resort to enforcement or lawsuits or other means to get to compliance, because to date, we're proud of Maine.
Great, thank you. A question about masks, and a very practical one, which is there's guidance that people should wear masks. Compliance seems to be mixed. One of the key exceptions is whether there's a medical reason why somebody can't wear a mask, and one is not allowed to ask about it unless one is their employer. And so compliance has been mixed. Again, any words of advice to consumers who walk around a store and see somebody not wearing a mask, or for a business inviting members of the public in, and how to deal with that?
Sure. So I will quibble with the word mask, because what we have advised is cloth face coverings. A mask in the medical world, the surgical mask, is a NIOSH certified medical grade face covering, but it does meet certain standards, FDA and or NIOSH standards, that a cloth face covering doesn't. So sticking with cloth face coverings, the US CDC back in early April advised it when individuals are in public space where it's difficult to socially or physically distance from somebody else, when you're in close contact with other people. The governor adopted that in her Stay Safer at Home guidance that got issued for the month of May. And it is not a substitute for anything we've all been doing. It's not a substitute for washing your hands, for trying to, again, stay distance. It's not a substitute. But what it does is it helps me protect you. If I have the illness, it prevents me from infecting somebody else, and vice versa. It allows somebody else to protect me. So it is a good practice. It is a good reminder to people that we are still in a period of time when there's a virus that we have no cure for and no vaccine for, is still endemic in the population. And we, again, are hopeful that we all take this precaution as a safety measure in public spaces. Again, we encourage people to encourage their neighbors, their friends, their customers, their employees to abide by this executive order. We're hopeful we don't have to go into a heavy duty compliance mode, but it is currently a requirement in the executive order that the governor issued for the month of May, that when people are in public areas where it's hard to stay 6 feet apart, you should be wearing a cloth face covering.
Great.
I think also, Jim, just really quick to add in there, we intentionally, after talking to lots of businesses, didn't ask businesses to enforce that in the public, right? So, they can enforce it, right? Because they're a private business owner. But we saw lots of things happening across the country and thought, we didn't want to put businesses in that position, and businesses asked not to be put in that position. So to Commissioner Lambert's point, we're hoping to stay out of that enforcement and do it. I hope people will kind of align to the work.
Great, thank you. That's helpful. Another set of questions that I've heard over the last number of weeks relates to the concept of a gathering, that there's some specific guidance for whether it's summer camps opening or the lodging industry, other activities that might take place. And then there's superimposed on that a limitation on gatherings. Is there a definition of gathering that says that means a group of people in a single room or in a confined space outdoors? How does one know whether one is actually part of a gathering?
I will give an answer which is more of a non-answer, I'm afraid. I mean, I think we're following the US CDC guidance on gathering, as well as like the White House in its guidelines for reopening America again, in having sort of a fairly loose definition of gathering. We do have size limits because, again, when we think about COVID-19, the spread is person to person. It's really about a physical proximity with aerosolized virus. So, right now the guidance is gatherings less than 10. The governor anticipates that we'll go to 50 in the month of June and for the summer months. But short of that, we are trying not to be prescriptive and leave it to the good judgment of people, both at home or in business settings, to implement that in a practical way.
Getting back to sort of guidance, obviously a lot of discretion is left to individuals, a lot of discretion is left to businesses. Both businesses and individuals worry about enforcement when standards are vague. I guess what I'm taking away from the conversation is that discretion is intentionally so, and that, I guess, does enforcement occur for businesses or individuals who might improperly interpret some of these standards?
So I think we all recognize that there's a lot to this, right? And so from an enforcement perspective, we're trying to take a very different approach, right? The first step is an educational discussion about any situation. And then if there is ongoing non-compliance on really key issues, then we'll move into enforcement worlds. But the first piece, and has been since we started this, is really about an educational discussion of, here's the intent, here's the letter of the law, here's the intent of the rule, and why and how, and then get to a discussion with individuals. So, I think we've seen Maine people and Maine businesses do an incredibly good job, to Commissioner Lambert's point earlier, of, taking this seriously, flattening the curve, putting us in this position now where we can start to move forward much more quickly than I think we would have been able to otherwise. And so, I think we want to continue that mentality, right? Which is, people will make good decisions. Businesses, it's in their best interest, right, to protect their employees and to protect their customers. And most of the dialogue we're having with businesses is around that little detail of, can I do it this way versus this way, or this way versus this way? It's not about any challenges with wide compliance. So, I think we were encouraging businesses to kind of use good judgment, right? Use the guidance, apply good judgment to the guidance, and we'll all recognize that we're trying to work through this together.
Great. No, thank you. That's
that.
I don't know if Commissioner Lambert, you wanted to add to that. Thank you. That's helpful. I'm going to ask one more question, and I think we're bumping up against the hour. And that is, I just wanted to thank you all and the administration. I think as the guidance has evolved, it has gone from a focus on essential versus non-essential to a more recent order said, now the focus is on whether a business can operate safely. That seemed to be a very prudent step, appreciated. So thank you for that. I don't know if you have any comments as to why the shift, why we were able to make that shift.
I think as we continue to try to move forward, right, and you restart the economy, essential is really about what can't you do without, basically. You need groceries, you need mental health services, right? You can put some clear things in that bucket. As you start to move forward, then you can start to apply other thinking to this. And this safe thinking is a key principle of how and when do you go. There are certainly other pieces, though. We get a lot of feedback from, I can do my individual business safe, why can't I go? And I think, right, what we're trying to do is move kind of groups and sectors consistently so that there is some level of consistency. And maybe Commissioner Lambert, if you want to talk about the phasing as it relates to numbers of people and changes so that we can isolate challenges.
Yeah, and this has been a real hard one for us because we recognize that there may be other businesses that are not in stage 1 or maybe in stage 2 that say that they could operate safely, but this numbers point matters. As we begin to allow people to engage, to leave their homes, to be in settings where they're interacting with other people, what we're trying to do is do this in a graduated way. So if we do see a surge, if there is an outbreak, if we do have some sudden problem, we can easily dial that back. If we do this all at once, that would be much harder. So we appreciate that poses real challenges to some of our businesses. But again, I'll go back to what Governor Mills has prioritized is public health. We just have to take this slow. This is unknown territory. There's no playbook for COVID-19. So we are doing this in a way that we think puts us near the front of the pack with other states in terms of what we're doing and how we're doing it. But we do always have to have that dial. If indeed things continue to be good or improving, we can do more and do more faster, but we also need to be prepared to do the opposite.
Thank you. And I think that's very well said. There is no playbook for COVID-19. And notwithstanding that, you two in particular, Dr. Shah, the entire administration, working collaboratively with the business community, individuals, citizens, residents, we're all working our way through these challenges. So we want to sincerely express our thanks and appreciation to your good work, for your joining us here this morning. These are tough issues and questions, and we know that you all are doing your best to work through those challenges. So thank you so much. As we, I guess, turning to the rest of the Chamber's work. This will conclude today's virtual Eggs and Issues. Please remember to stay up to date with all of our virtual events by subscribing to the Chamber newsletter and following the Chamber across all social media platforms. Thank you, our audience, for joining us this morning. Please mark on your calendars that the next Eggs and Issues is Wednesday, June 10th. We anticipate that will be a virtual Eggs and Issues as well. So again, thank you to our guests. Thanks to you. Thank you to our sponsors. Please be well and have a great rest of your day. Thank you so much.